Welcome students to our new YouTube channel Pharma X Tech, the division of excellence. So let's start to the new chapter of pharmacology, which is cardiovascular system and drugs. So this is cardiovascular systems and drugs. This is most important topic for your GPAT exams and also MST CT exams and for your daily general knowledge. So in that we first see the introduction towards this cardiovascular system. So many believes that the heart is the first organ to become functional. Heart pumps more than 14,000 liters, that means 3,600 gallons of blood in a day. Heart circulates blood 1 lakh kilometer, that means 60,000 meter of blood vessels. Heart beats 1 lakh times every day. And the cardiovascular system consists of blood, heart and blood vessels. And the layer of heart walls consists of epicardium, it is external layer, and myocardium, it is middle layer, and the endocardium is the inner layer. And the heart for the average human will contract about 3 billion times, never resting, never stopping to take a break except for a fraction of second between beats. The heart pumps blood due to its rhythmic contraction through two circuits, a shorter pulmonary circulation and a longer systemic circulation. And the heart valves ensure unidirectional blood flow within the heart and in some veins. Each circulation circuits consist of arteries, capillaries and veins, which carry the blood back to the heart. So next we will see the heart. So the heart is a hollow muscular organ about the size of a fist. The heart is responsible for pumping blood through the blood vessels by repeated rhythmic contractions. And also the heart is composed of cardiac muscles and involuntary muscles tissue that is found only within these organs. And the term cardiac, as in cardiology, means this is related to the heart and comes from the Greek word cardia for heart. It has a 4-chambered double pump and is located in the thoracic cavity between the lungs. And the cardiac muscle is self-exciting, meaning it has its own conduction system. This is an contrast with skeletal muscles, which requires either conscious or reflex nervous stimuli. The heart's rhythmic contractions occur spontaneously, although the frequency or heart rate can be changed by nervous or hormonal influence such as exercise or the perception of danger. So next we see the physiology. The heart pumps oxygenated blood to the body and deoxygenated blood to the lungs. And in the human heart there is one atrium and one ventricles for each circulation, and with both a systemic and a pulmonary circulation there are 4 chambers in total: left atrium, left ventricle, and also the right atrium and right ventricle. The right atrium is the upper chamber of the right side of the heart. The blood that is returned to the right atrium is deoxygenated, that means they have poor in oxygen, and they pass into the right ventricle to be pumped through the pulmonary artery to the lungs for reoxygenation and removal of carbon dioxide. The left atrium receives newly oxygenated blood from the lungs as well as the pulmonary veins, which is passed into the strong left ventricle to be pumped through the aorta to the different organs of the body. And the cardiovascular systems of humans are closed, meaning that the blood never leaves the network of blood vessels. In contrast, oxygen and nutrients diffuses across the blood vessels layers and enters the intestinal fluid, which carries oxygen and nutrients to the target cells and carbon dioxide and waste in the opposite direction. And also the other components of the circulatory systems, the lymphatic system is not closed. The heart is located in the center of the body between the two lungs. The reason that the heartbeat is felt on the left side is because the left ventricle is pumping harder. So next we see the measurement techniques for this heart. The first technique is electrocardiogram for cardiac electrophysiology, and also sphygmomanometer and stethoscope for blood pressure, and also the pulse meter, it is for cardiac function like heart rate, rhythm and dropped beats. And also the pulse, this is commonly used to determine the heart rate in absence of certain cardiac pathologies. Next measurement technique is heart rate variability. This is used to measure variations of time intervals between the heartbeats. So next we will see the electrical conduction system of the heart. The normal electrical conduction of the heart allows the electrical propagation to be transmitted from the sinoatrial node through both atria and forward to the atrioventricular node. Normal or baseline physiology allows further propagation from the AV node, that means atrioventricular node, to the ventricles and Purkinje fibers and respective bundles, branch and subdivisions or fascicles. Both the sinoatrial and atrioventricular nodes stimulate the myocardium. Time-ordered stimulation of the myocardium allows the efficient contraction of all four chambers of the heart, thereby allowing selective blood perfusion through both the lungs and systemic circulation. So, next we will see the electrochemical mechanisms in heart. There are 5 phases in the cardiac action potential. The first one is phase 0, in that the depolarization, that means opening of Na plus channel and Na plus gives Na plus rushes in, and the phase 1, in that inactivation of Na plus channels, and in phase 2 influx of Ca2 plus coupled with the slow outflow of K plus causing plateau, and in the phase 3 repolarization, that means release of K plus channels, and in phase 4 resting membrane potential is minus 85 to minus 95 millivolt. And also the cardiac neurons are uniquely subject to influence by the sympathetic and parasympathetic influence of the autonomic nervous system, that means ANS, unlike skeletal muscles. Like a neuron, a given myocardial cells has a negative membrane potential when at rest. Both Na plus and K plus channels are closed and the membrane's resting potential is maintained. Stimulation above a threshold values induce the opening of voltage gated ion channels and inducted flow of cations into the cell. The positively charged ions entering the cell causes the depolarization characteristics of an action potential. A stimulus opens some Na plus channels, and if the Na plus influx achieves threshold potential, then additional Na plus gates opens and triggering an action potential, and the activation gates of the Na plus channels are open but the K plus channels are remain closed. The Na plus ions rush into the cell and the interior of the cell becomes more positive, and the Na plus close and the potassium channels open, the K plus ions leave the cell and the loss of positive charge causing the inside of the cell to become more negative than the outside, and the Na plus channels are closed, but the slower K plus remains open. That means potassium channels remains open. Within a millisecond the resting state is restored. So in this way we see the introduction towards heart. In that we see the introduction of hearts and its physiology of heart, and also the some measurement techniques of the heart like electrocardiogram, sphygmomanometer and stethoscope, pulse meter, pulse and heart rate variability, and also we see the electrical conduction system of the heart and also electrochemical mechanisms of the heart. So in this way we end this chapter cardiovascular system first. So next we will see the various drugs which are used in cardiovascular systems. So thanks for watching this video lecture. Hope you like this video. Please, if you like this video, please comment on comment section, and please share this video to more and more to your GPAT aspirants as well as CET aspirants too. So, and like, share and subscribe to our channel, and thanks for watching. Stay tuned with Pharma Extract. Stay connected with Pharma Extract. Thank you for watching. Stay connected. Stay tuned. Welcome students to our new YouTube channel Pharma X Tech, the division of excellence. So let's start to the new chapter of pharmacology, which is cardiovascular system and drugs.